Mr. Chairman, we're on the brink of passing something so historic, right up there with Social Security and Medicare. And we would not have been there in the manner in which we are, with the great focus on people who are Medicaid or middle-income people who need subsidies, just enabling many more people to participate by making it affordable without the leadership of Chairman Charlie Rangel. It would be impossible for me to exaggerate his relentlessness at the table on behalf of people, for expanding access to those who haven't had access, but to make it affordable for those who have it and continue to be able to have it. And a fighter for his state, in which he was a leader in doing things, being on the forefront. And we call that the do-gooder provision in the bill that Charlie Rangel was so much a part of. So thank you, Charlie. I know that one of your purposes here today is to talk about HIV and AIDS. And the day I was sworn in over 22 years ago, I went to the floor. They said, "Don't say a word, just raise your hand and say yes." And then the speaker said to me, "Does the newest member of Congress wish to say something?" Well, I didn't know they were going to ask me, because all of my colleagues had said, "Don't say a word." So I said, I'm here, and I've come to fight against HIV and AIDS, and sat down. And other members came up to me and said, I thought I was so proud of myself, because, I'd come from San Francisco 22 years ago. They said, "Why did you say that? Why would you want people to think that that's their first impression of you, that you came here to fight against HIV and AIDS?" And I said, well, I said it because that's why I came. And we have all been standing here. A great, great, great majority leader has joined us. And he has been part of that fight, which really a lot of it is culminating in this health care bill. Because what we want to address in the health care bill is bringing many more people into the loop, to reduce the disparities among our ethnic groups simply by having people in the loop. Our principle is based on the fact that the most privileged person in America's health care will be better if the poorest person in America has access to health care, because we're all in this together. We're very close. I understand you're going to have a press conference supporting this later today. That's very important. I have some good news. This isn't being raised Catholic. You understand why I'm so excited about this. Catholic nuns are urging Congress to pass President Barack Obama's health care bill in an unusual public break with bishops who said it would subsidize abortion. Catholic nuns urge passing that. Some 60 religious orders representing 59,000 Catholic nuns sent lawmakers a letter urging them to pass the bill. Isn't that something? Because that really is, as Charlie described, this is historic. God blessed us in a way that we, and whatever our service was, our leadership, whatever, that enabled us to be here present at this time to say we are acting upon a principle that health care is a right, not a privilege, in our great country. And we will take that vote in a few days, and under Steny leadership, as he controls the floor, as he brings it to the floor, we will be certain that we will have the votes to pass the bill. But more work needs to be done. So as you're talking to folks or talking to people in the communities, in some of the districts that may not have African-American representatives but have African-Americans represented, many there, about the health bill and what this means, what it means in terms of the education bill. Over $2 billion for minority-serving institutions, historical black colleges, and black-serving institutions, as well as Hispanic-serving institutions, Native American tribal colleges, to just say these institutions are now going to be pulled up in terms of the investments that will be made there, and compete for grants and everything in a completely different way. So this is about thinking in a different way, to think entrepreneurially. Jess, you know, we all know the reasons why we need health care and how important it is, the HIV/AIDS, which is the focus of the organization. But think of what it means to people to be able to follow their aspirations. Think of an economy where people can say, I want to be a musician, I want to be an artist, I want to start my own business, I want to be, then they don't have to worry about having health care to do. That is the biggest deterrent to the vitality of our economy, because people are job locked. If they lose their jobs and they lose their health care, they are up the creek. And now we're saying, if you change jobs or make a personal choice. For women, being a woman is a pre-existing medical condition at this time. There is no, there's gender discrimination in rates. When I had my 5 children when I was very young, in my 20s, they told me that I was off the policy because I had had children. I thought I showed my strength, but they said I was off the policy. If you have children, you have a pre-existing condition. If you can't have children and you want to, you have a pre-existing condition. If you have a C-section, you have a pre-existing condition. If you're a victim of domestic abuse, you have a pre-existing condition. So, and you could be perfectly healthy, but your husband might have a pre-existing condition. And so you are up the creek.